videos. So, like as it is displayed from the base of the from the base of this pyramid, we are seeing infrastructure services. So, infrastructure services, this can be like the foundation of the what? Of the entire public health system. So it can include essential structures, systems, and functions that support all health activities. Here you may find key functions such as health workforce training and management. There can be also data collection, research, and what? Health information systems. Here an example which I can give you. Let me take an example of Ministry of Health. Ministry of Health can develop national guidelines, let me say for malaria control, or it can set up a national health information system to collect data from all facilities. And this data, it can be analyzed and the findings can be used for decision making. So that is the infrastructure services. Then two, when we go to number two, we have population-based services. So this level, the population-based health services, we can include interventions aimed at the entire population rather than what? An individual. Here the interventions, they target a group of people rather than an individual. So these services focus on the prevention and health promotion to reduce disease and also improving what? Health of the well-being. For example, you can see programs such as immunization campaigns for all children, then epidemic surveillance and control of diseases. Last time we had a pandemic that was COVID. So teams were carrying out surveillance, passive and what? Passive surveillance. And also there was controlling of diseases. Personally, for me, where it found me, they were doing the surveillance starting from the village levels. Even they put, there was a toll free. If you happen to find someone who could be having signs, there was that toll free number. There was a hotline. So you just call, they come for that person. And they were not ending there. They used even to trace the contact of contacts, those people who have come into contact with that person. And they used to fetch people. You just be there, you just see an ambulance coming for you. So they take you. So that was control of diseases, the pandemic we had. Then we can also have things concerning environment health programs, such as water treatment and waste management. So here, they mostly target the population, not an individual. Then also public health education on hygiene, can be on hygiene, nutrition. There are many. So that was that population-based services. Then the third one was enabling services. Enabling services, these ones, for them, they just support the system that help individuals and the community. Communities access and benefit from health care. This one, they just support the community to access healthcare services. In other words, they just remove barriers such as lack of information or financial constraints. For example, previously people have started insurance systems. So for insurance, when you happen to get any cough or malaria or any disease, you just go to any facility, you present your card, then they happen to attend to you. So they will have removed this the problem of what? Finances. Then we've seen health outreaches and home visits by community health workers. That one is also an enabling what? Enabling service. Then we have seen services like counseling, the nutrition education, the health camps. They have been coming into the community. They provide free services to the community. So they have removed barrier of distance and financial constraints. So that is enabling what? Service. Then the last one, which is on the top of the pyramid, that is direct health care services. So here at the top where you're seeing direct health care services, these services for them are they direct personal health services. And these services they are provided to, they target an individual. These services sometimes can be, you can say, diagnosis. You diagnose a person, then after diagnosing a person, you have to treat that person. If things don't go on well, then we have rehabilitation. So they just address the specific health needs of people who are already sick or at risk. For example, you can say surgery and rehabilitation services, like for people who have diabetes. So while this level has a what? A narrow focus, individuals rather than population, because it targets an individual rather than population. It is vital for restoring and maintaining health. Simply, that's how I can explain for you this. That is the pyramid. You do more research and you find more resources about it. That is the health pyramid. So this is the information they tried to also to give here, the direct health care services. So this information, the enabling population health services, the infrastructure, the ones which are at the base. Yes. So from here, then we can look at the importances of a public health pyramid. So one, it provides structure and coordination. It provides comprehensive health care, guides resource allocation, and also improving health population outcomes. So when you see this public health pyramid, is not just a diagram, but it is a framework that organizes health services from system level infrastructure to individual care. So when they say that it provides structure and coordination, here it organizes health services into clear levels, that is infrastructure, population-based, enabling, and direct care, ensuring that all areas of public health are covered and well coordinated. The way how you were seeing the levels were structured, starting from the infrastructure up to the top of the pyramid, that it shows coordination. Okay, I thought someone had raised up the hand. So the other one was promoting comprehensive health care. So by combining the preventive, supportive, and curative services, the pyramid ensures that people they receive what holistic care from disease prevention to treatment and what and rehabilitation. When they talk about comprehensive health care, uh, it gives us a picture that disease prevention and supportive then curative systems. So comprehensive health care, this one it looks at services, or it looks at someone as what a whole when they say holistic care, whereby there is a prevention to treatment and rehabilitation. It looks at the patient in a holistic way as a whole, starting from prevention to rehabilitation. Then guiding resource allocation. This one it will help policymakers to identify where to invest. For example, strengthening infrastructure, expanding community outreach, or improving what healthcare services. So it will guide on what resource allocation. Then improves population health outcomes. So when you emphasize prevention and system strengthening, the pyramid ensures what long-term health benefits for the whole what for the whole population. So that's why they are saying that it improves population health outcomes. Then this is community needs assessment. We talked about this last time. The purpose of needs assessment, whereby they are saying that it guides and inform decisions related to problem prioritization and problem development. So remember, when you do a needs assessment, it can help to prioritize. It can help a person who is carrying out this needs assessment to prioritize their needs. So here resources are always, remember, resources are always what? Limited. So we can't address everything at once. So we need to prioritize needs. Remember, this needs assessment, when you collect data, it can help in ranking what? In case there's a problem in the what? In the community, it can help in ranking problems according to their urgency and what? Severity and impact. So this ensures that the most critical and high impact issues are done what? They are addressed first. So that's why they are bringing this problem prioritization and what? And problem development. That those problems which are most critical and they are of high impact, they will be addressed what? First. So that's what they are trying to say. So here they are talking about the community, the elements of the community, people, the place, then interaction, then nature of community health programs. So here we have there are three. We have community-based, have community-focused, then community-driven what? Community-driven programs. So community-based programs, these are program or service. The program or service is provided in the what? In the community. So these community health programs, they can be initiatives, but those initiatives, they are designed to improve the health and well-being of people within what? a specific community. So those are the what? Those are the health programs. They are initiatives. They are designed to improve the well-being and the health of the people within a specific community. So when we say community-based program, these are basically, as they have said, that they are provided in the community. So these programs, they are usually implemented within the community and often involve, partnership between professionals and community members. Since they are provided in the community. For example, we can have a community-based HIV care program. Here you find that the community, trained community health workers, they provide counseling, then home visits, and also support for patients on on ARVs, those ones who are taking the drugs. So these services they are provided in the community. Then the other one is community-based, community-focused program, whereby for them they focus on the impact. They focus on impacting the whole community. These community-focused programs, for them that they are designed, and sometimes their target is the community, and then also improving the health outcomes. And sometimes they are managed by external agencies. You can have like NGOs. So here an example, I can talk about immunization campaigns. They are sometimes organized by the Ministry of Health, whereby the communities also participate by bringing their children for immunization. So that is an example on community focused programs. Then the third one, it is a community-driven programs, whereby they are saying community is the origin. Community is the origin of the program. So here, in other words, these programs are initiated, designed, and they are led by by the community itself, since the origin is from from the community. Here, the community identifies its own health problem. So after identifying its own problem, it will plan solutions. Then after planning for the solutions for the problems, then they will mobilize for resources. Then after mobilizing for resources, then they have to, after getting the resources from themselves, then they have to implement the activities. With the minimal external assistance, they just mobilize for resources within themselves. They don't depend on external assistance. Here, an example which I can give, I remember sometime back in my village, there was a women's group. So this group, what they did, they started up a community home gardening project. What was the cause of this? There was the prevalence of child malnutrition under fives. It was high. So it had an impact. So the women group, they started up a community home gardening project. After realizing that there was high rates of this child malnutrition. So what were they doing? They used to plant vegetables. They used to train mothers on food preparation, and also they used to after the yields, they used to to share the what? The yields, the cereals with the neighboring household, so that they can also do what? They can plant, provided they used to have large pieces of land. So they used to share. So the initiative was fully community-led and sustained without what? Donor funding. So it originated from the what? From the community. That was a community-driven what? Program. And it was on nutrition. So this is the same thing, trying to show us the community-based, community-focused, and community what? Community-driven. So these ones, I want to give you an assignment. You can research about them, the models of conducting the needs assessment. That is the epidemiological model, public health model, social model, then asset. For epidemiology, this one it will just focus on what? On the problems of health, whereby there is a using what? National data sets and applying epidemiological methods and statistics. So you can read about descriptive epidemiology, then also analytic epidemiology. You get to know the definitions, and they are what? You compare and contrast. The same here, public health model. This one it just focuses on quantifying health problems for the purpose of prioritizing the what? Identified health problems being addressed with the limited resources. You also read about that. Same with social perspective, then asset perspective. Then we have rapid perspective also. This one uses multiple models, methods such as focus groups, existing data, interviews, and mapping. So we also read about that. Yes, then we shall just go straight to types of assessments. So we have a number of familiarization assessment, organization, then also marketing needs assessment, have workforce assessment. So they started with familiarization, whereby they were saying that familiarization assessment, before an assessment, gain working knowledge of the what? Of the problem. So for you to start up a project, you have to first familiarize yourself with the environment where you are going to conduct your project, health project from. First do a report, find out different types of, let me say, food, the taboos, the culture of the people whom you are going to be interacting with. So you first familiarize yourself and get knowledge on how you will be conducting the what? The project. That is familiarization. Then for organization, what is the strength, weaknesses of the organization implementing the what? The health program. So here you look through the organization and try to assess what are some of the weaknesses an organization may be having. Could it be resource constraints, staffing? So the data you get, it will help you to do what? To have a better decision for you. That is organizational assessment. Then for market assessment, this focuses on the extent to which target audience would be interested in the what? In the health program. So here the purpose could be for you to understand the target population needs and the what and the preferences. It can also help you to identify the barriers. Would it be costs, accessibility, or the awareness? Here, maybe the example I can say I've seen these organizations which have been which have partnered with this what UNHCR for those people in the camps. There's World Food Program, so they have been giving people assistance, food, fortified foods. But they do assessments. So what they normally do, they first get to know what are some of the foods which are nutritious to the what? To the people. Remember, in the refugee camps, most of the challenges is malnutrition. So they first identify the vulnerable groups of people. Then the foods, the supplements they normally give to those people, the energy biscuits. So fortified, I used to see fortified cooking oil. So here, marketing assessment before you have to before introducing these fortified supplements, an organization conducts what? A marketing assessment to find out whether people know the benefits of fortified foods. Because you may give those fortified foods to people, others they may end up selling. So you find out whether people know the benefits of these fortified foods. That is what I can talk about market assessment. Then for needs assessment, this one you just determine the gaps, the lacks, the wants relative to a defined population and to define a specific health problem. This one it just helps you to prioritize problems as I said earlier. It helps you to prioritize problems, then you set objective, then also it guides you in planning and resource allocation.